strike action, greed, nonchalance, incompetency. These and more, reports claim, are the causes of patient neglect by health workers in Africa. Medical attorneys in South Africa define medical negligence as a negligent act or omission by a medical professional that results in personal injury to a patient. Furthermore, the NCBI states that patient neglect could be physical or emotional. A judge recently ordered the South African government to pay $100,000 to each of the families of 144 psychiatric patients who died of neglect, the Punch newspaper reports. Many of the deaths occurred after patients were hurriedly transferred from a private hospital to 27 poorly prepared facilities as a cost-cutting measure. This abysmal act of negligence has become very popular amongst many health professionals across sub-Saharan African countries. Our question is, what is your take on patient neglect by health professionals in Africa? From the premises of Acid Park Lane Hospital in Enugu, this is Health District Africana on the streets. I'm GILLIAN Sinclair.
Okay, first is whether there is neglect.
Okay, I think it's a recurrent situation in Africa, but it depends. Because in Africa we have two institutions where it has to do with health sector. We have the private sector, we also have the public sector.
Yes, my experience is that there is neglect of patients by health professionals across health facilities in Africa.
To me, it's not funny at all, because most especially those that doesn't have the money to take themselves to hospital, you see, they will be like, hospital is not a charity organization that they can't treat a patient without the person depositing money or something like that, even when that person, their life is at stake.
Patient neglect in Africa, the thing is becoming a worst and intolerable thing, you know. Sometimes when patients, especially accident patient, emergency, when they come in, the way they treat them, they don't treat them like human beings. At least they should give them care before they will now start asking either for police, you know, attend to them, you know.
But it's important to distinguish between the public health and the private health facilities, because this has implication for the nature of neglect. The neglect appears to be higher in the public facilities, owing to poor supervision probably, and then very importantly, the way the medical profession in Nigeria is framed is such that the medical professional, especially the physicians in this respect, see themselves as demigods, offering help and doing favor to the patients, and then on the other side, the patients see themselves as people who are favored by being attended to by the physicians, and they do not know their rights.
I had a patient who had an accident. I rushed him to the hospital, where I met a doctor. I think they gave me, oh please, we're coming. I spent about 5 to 10 minutes. No attention was given to the patient. And I came back again. They gave me another time, please. I remember that I spent about 30 minutes or 1 hour thereabout. At the end, nothing was done. I had to take him out from this patient and then rush him to another private hospital. So I think it's something else.
The last time I took my mom to hospital, it happens that there's one woman there that are supposed to come with the children, but it seems out of the urgency, the woman have to come by herself. But because he doesn't have any money at the moment, he was pleading, let them attend to her first, then the children will come later and pay. They refused, and the woman was helpless, even with the pain she was passing through. Nobody is there to take care of her or even to listen to her problem. It was touching.
I think where it's common is in the public sector, though it depends on the mood of the health worker, either the nurse or the doctor, because sometimes they have this overbearing and frustrating attitude, maybe as a result of what they are passing through from their family or from the management. Do you understand? Then sometimes when they have this kind of issue, instead of leaving it at home or leaving it where they got it from, they will carry it over to their patient.
Because of the poor supervision, absence of adequate facility in the public health, what you find in the public health facilities is that the public health facility is like a marketing section, you know, especially for the consultants, as they call themselves, who simply come there to give their complimentary cards to patients, inviting them, if you think what we are offering you here is not good enough, then why don't you visit my private facility? So what you find is, one, there is health, there is neglect of patients. Secondly, it is caused by cultural factors, the way, as I've said, the health professionals see themselves, and then the economic factors, absence of adequate facility, and then on the other side, poor knowledge of health rights by the patient. Yeah.
With reports of bed sore ridden Congolese patients in a Zambian hospital, Rwanda's increase in hospital death rates, greed triggered in Somalian quack health workers, expecting mother left to bleed to death in Uganda for not bribing health professionals, Nigeria is not left out of the equation. With reported cases of lost body parts, wrong diagnosis, forgotten surgical equipment inside of patients, the endless patient negligence list goes on and on. Defaulting health professionals or facilities stand the risk of being sued for medical malpractice, or in worse situations, have their licenses revoked. What are the solutions to this? We ask.
So I think they should work on that, their ethics, in terms of they should save life first. That is their profession here, in trying to save life, not you must pay before we attend to you, most especially in the case of emergency. They should try and save that person's life, then give the person condition. If you didn't meet up by paying as at when you, maybe you're not going to be discharged, or you're going to do something about, they should try first and save life.
There should be a culture of supervision to actually supervise these health professionals, to supervise what is happening in the health facilities, to know whether actually the health professionals are delivering the service for which they have been employed and for which they have been paid.
But I think patients should also have to know their fundamental human right when it comes to that. Since you have paid for the services, you need to be attended to the way you are ought to be attended to. I think all hands must be on deck in this situation, because everybody has his own right. Where your right stops is where my own right starts.
I think maybe government has to intervene, maybe by providing one or two things that the hospital need, or increasing their salary if that's the case, or at least having an additional money for those that cannot afford the hospital bill, or encourage the doctor. They should treat the patient first, then later those people can now pay.
On the other side of it, it is also important for the patients to be aware of their rights. Most patients don't know their rights. For instance, you go to the hospital, my little knowledge is that I should be aware of whatever drug they are giving to me, okay? If, for instance, for some reason you are not attending to me for a particular time, you know, I should be aware why you should not attend to me. And I should also be aware of where should I fall to in case I am not attended to. Where should I report the case to? You know, where should I go to remedy the situation?
There should be a counseling office, do you understand, whereby if a nurse want to take up a duty, or a doctor, the psychologist or the counseling officer should have to, first of all, meet these people, talk to them, tell them how to relate to their patient and all that. They shouldn't be harsh. They shouldn't use their frustrating attitude or overbearing attitude to meet their patient, because patients are those who are suffering from one illness to the other. They need all the love, all the encouragement, all the motivation. So if you add to this, they might not be, you know, they might not recover as soon as possible.
I think continuous training on how to handle human beings, because they are human beings like them. They should be treated not like animals, you know, or dumped just because of simple either getting police extracts. They should be treated fine. Maybe they should be giving them training upon training on how to care for human beings.
The solution, I think, should be if the federal government or state government have time and know that end of the month, pay the workers. The helpers, when they are smiling home, they will remember they have patients in the hospital and they take care of the patient in the hospital. Yeah.
There are 3 things that should be considered when assessing the healthcare options in any country: quality, affordability, and accessibility, the international living opines. Countries like Panama, Colombia, Mexico, Malaysia, and Costa Rica provide clean, excellent hospitals, highly trained health professionals, and affordable care. In Panama, for instance, doctors spend more time with patients, even giving out their cell phone numbers so they can be reached directly, the international living asserts. With all hope not lost in the African health sector, New Vision, a health blog site, suggests that ethics, morality, and humanity should improve health workers' attitudes on the continent. African medical professionals should learn from the Ebola heroic Liberian nurse who graced the November 2014 cover of Times magazine. She was celebrated for her strength and humanity towards Ebola patients. She saved lives, helped babies who had Ebola, and helped them get better, according to the Punch newspaper. But she died because she was neglected by nurses and doctors.
And that's it on today's episode of Health District Africana on the Streets. Kindly follow Health District Africana on Facebook, Instagram, and YouTube. Remember, we are a tradition of health awareness excellence for Africans. It's been GILLIAN per SINCLAIR. And until next time, stay healthy, stay safe, and thanks for watching.